through consistent journalism. By integrating the mental health awareness in our editorial mandates, we're championing a cause, friends, and that is imperative to the well-being of our societies. And as we're here to reframe mental health not as a distant issue, but as a present and pressing reality in every community, affecting one and all those from the bustling markets of Nairobi to the serene landscapes of Cape Town. As we escape and exchange ideas and share strategies, let us be guided by compassion, informed by research, and driven by unyielding commitment to make mental health a common thread in the fabric of our stories. So our roundtable today is not just a forum, but it's rather a forefront of hope, signaling a new dawn where mental health is embraced as fundamental pillar of public health. And I strongly believe that together we are embarking on this transformative journey with a clear vision and a firm to resolve to be the change we wish to see in the media landscape of Africa and globally. So thank you once again for joining this conversation. And in this conversation, I won't speak alone, but I'm going to be joined by great speakers. I have Charlene Sunkel, the founder and CEO of the Global Health Peer Network, and she's going to be speaking to us on quite a very remarkable topic. And not only that, I want us to, in a special way, appreciate people that have supported this mobilization. The Carter Center, who shared it with the partners like Mental Health Network Liberia, who joined in from the Carter Center in Liberia, plus the SADC from South Africa. These we can't fail, we can't stop thanking you again and again. And also the Center for Journalists Innovation and Development and the Couch Center Association. Thank you so much. And last but not least, it is the Global Mental Health Network. It is because of them that we're here today to start the conversation. And I would love to start this conversation right off with Sunkel. But maybe to those of you who don't know Sunkel, allow me to give you a little bit of her that you understand. She's the CEO of the Global Mental Health Peer Network, very dedicated advocate for the rights of individuals with mental health conditions. Drawing from her own lived experience, she has collaborated and contributed significantly to the field through her writing, co-authoring numerous papers for a lived experience perspective for esteemed international publications. Ms. Sunkel's impact extends her roles as a commissioner on the Lancet Commission on Global Mental Health and Sustainable Development, and also as a co-chair of the Lancet Commission on Ending Stigma and Discrimination in Mental Health. So today, she brings her expertise to various international boards and committees, even to these conversations, including her past involvement with the South African Presidential Working Group on Disability and the Ministerial Advocacy Committee on Mental Health. Previously, Ms. Sunkel served as a principal coordinator for the Movement for Global Mental Health. Her contributions have been recognized with national and international awards, including the Swiss Foundation, World Health Organization Outstanding Achievement in the field of mental health, the PADS Humanitarian Prize in Mental Health, and the WPA Presidential Commendation. Ladies and gentlemen, allow me to welcome Sunkel, as she's going to be speaking to us today on a matter that is so much around us, but oftentimes, because of our work schedule, we actually miss it. Sunkel, as you're coming in, would like you to share with us about the Lancet Commission study, the key findings and the progress with the recommendations up to date, especially those related to the media. You have 5 minutes for that, Sunkel.
Thank you very much, and thank you for this opportunity. I'll just jump right into the kind of the component of the importance of stigma, like really discussing this topic, because it disrupts people's lives, and I think we can all agree on that. From the Lancet Commission, some of the key themes that came across was that stigma and discrimination is often found to be worse than the symptoms itself from people with mental health conditions. Also that derogatory terminology that's often used also encourages further discrimination, and we often hear people saying you schizo, or you are a depressive, So kind of defining the person by their diagnosis or their mental health condition. More importantly, it also violates human rights because it promotes exclusion. It also denies people's life opportunities like access to employment, education, and other opportunities. And we also know that it influences help seeking because you are afraid to go seek help because of the fear of being stigmatized or discriminated against. But for me, the core issue around stigma is that it prevents governments and stakeholders to really access that valuable expertise of people with lived experience. The Lancet Commission, one of the key findings was also placing an emphasis that people with lived experience must be involved in leading or co-leading anti-stigma initiatives, and that we play a very important role. And probably the most effective way, that's also one of the key findings of the report, is that we can do so through social contact. So social contact, if we look at what exactly that means in the context of mental health. So that is basically where a person with a mental health condition interacts with people who do not have a lived experience. What the commission also found that there wasn't really much of a difference between either having virtual contact, like videos, or like here, a platform of discussion, or whether it be in person. So the commission also did an assessment on anti-stigma intervention. So we looked at 216 systematic reviews on anti-stigma interventions. And again, that core finding from that was social contact is the most effective way. In terms of the role of the media and stigma, what also became quite clear, there was a dedicated section and focus on the media, was of course there's two sides of it. That the media can play a very important role or powerful role in actually increasing stigma by reinforcing stereotypes associated with mental health conditions or persons living with such conditions. For example, seeing people as being unpredictable or dangerous. Then on the other side of things, the media can also play an extremely powerful and important role in decreasing stigma when it aligns with guidelines and responsible and ethical reporting. And from that, there are several resources developed, and one of those is also the WHO guidelines on reporting on suicide, amongst others. From my side, there's 8 recommendations, and I think I'll probably have more time later to go through that. But maybe what I will mention in conclusion now is that after the report was published, a Commission implementation partnership was developed with key partners, international partners, and that includes the Global Mental Health Peer Network, United for Global Mental Health, World Psychiatry Association, the National Council for Nurses, International Council for Nurses, and also recently added was the Global Leadership Exchange Organization. So all of these partners are kind of assigned or taken responsibility to implement these 8 key recommendations going forward. And I think later I'll maybe just explain, have more time to explain exactly what's been achieved through leading these implementation and monitoring the progress of this. Thank you so much.
Thank you so much, Charlene, that is quite deep, but I want to request all the participants to kindly introduce yourselves in the chat. But while you're doing that, please mute your microphone until when the time will be due for you to actually come through. I'm very grateful that we have sampled a little bit of that challenge that you did with your team. That was quite very deep there. But not to lose the pace and the rhythm here, Ben Adams, do you mind coming in and talk to us about the best practices by WHO on reporting on suicide prevention? And those of you who don't know who Ben Adam is, allow me to tell you who Ben Adam is. Ben works for the World Health Organization and supports the Spatial Initiative for Mental Health program and work on suicide prevention. But prior to this, he worked as a senior mental health advisor for Global Disability NGO, where he was the technical lead for mental health across Asia and Africa and for MPSS globally. So Ben has a background in mental health nursing, holds a postgraduate qualification in global health and psychotherapy. He has spent years living and working across Africa and Asia. And Ben has worked in various roles as a clinician, in leadership, and as a mental health specialist globally. He has supported development and implementation of mental health programs, mental health law, policy, and system reform, and mental health research. Ben is very passionate about mental health, suicide prevention, and human rights inclusion. So Ben, as you're coming in, we would like to know from your perspective, what are the best practices by the World Health Organization on reporting on suicide prevention, especially to those of us that come from countries where suicide is still a crime? Ben?
Hi everyone, thanks Andrew. Yeah, I'll jump straight in the essence of time. So the WHO actually provides comprehensive guidelines for media professionals on reporting on suicide, which I think may be shared in the chat. And these guidelines are designed to promote responsible and ethical reporting while minimizing any risk of harm. And there's many recommendations in the guidelines, but I'll go through a few of the key recommendations. I think firstly, it's to avoid sensationalized headlines and imagery, and to provide context and resources for help seeking, and to ensure that we are signposting to available supports. All of this while refraining from, I think, explicit descriptions of suicide methods. Are all really helpful and is a key recommendation from the guides. The guideline stresses the importance of highlighting stories of hope and resilience and recovery, as well as avoiding simplistic explanations for suicide. Additionally, the WHO recommends providing context and factual information about the complexities of suicide, including its association with mental health issues and societal factors, instead of reinforcing myths, I suppose, or untruths about suicide and suicide prevention. Reporting should highlight the warning signs of suicide. It should promote help-seeking behaviors, as I said, and it should really emphasize that suicide is often preventable with appropriate interventions and support. Furthermore, the guidelines stress the importance of avoiding simplistic explanations or the glamorization of suicide. So instead, reporting should strive to portray suicide as a multifaceted issue influenced by various factors. And this approach helps combat stigma and encourages empathy towards individuals who may be struggling with suicidal thoughts. Journalists as a whole are really encouraged to avoid intrusive or graphic reporting on suicides. As such, coverage, I suppose, can be very distressing to audiences, and it increases the risk of what we call copycat suicides or contagion suicide. And respect for the privacy and the dignity of those that have been deceased by suicide or loved or have lost loved ones is also paramount in reporting on suicide. And I think finally, the WHO really encourages collaboration between media professionals, mental health experts, and suicide prevention organizations to develop and implement, these guidelines and other best practices on suicide. So it's really good to see events like this and to see such a collaborative group and coming from different backgrounds. Training and support for journalists in understanding and applying guidelines such as the WHO guidelines can further enhance the quality and impact of their reporting on this really sensitive topic. And I think what else is really important to highlight here is the importance of self-care and help seeking among journalists and those working in the media who who themselves, of course, can be affected by stress and mental health conditions and suicidal thoughts. But just to summarize, I think by following the recommendations in the WHO guidelines, journalists can play a really vital role in promoting suicide prevention, in reducing stigma, as Charlene was discussing, and in fostering a supportive, I suppose, and informed public discourse on mental health and suicide, and really, I suppose, promoting suicide prevention efforts globally.
Wow, Adam, while you're speaking, I'm thinking how fast we need this in Uganda, and possibly my friends in Kenya will agree the same. And in case you're missing out the guidelines Adams was referring to, please check the chat. A link has been shared. Tap on it so that you're in position to stay in sync with us. It's a couple of colleagues that have joined us here. I see Oliver Nzomo is coming in from Kenya Coalition for Preventive Mental Health. I see Danston Odachi, consultant, PHI Global Molo Kenya. Karibuni. Ademboale, I work with the Center for Journalism, Innovation and Development in Abuja. Good to have you. It's very interesting. Why so Juliet from the New Vision, representing Violet Nabatanzi, senior health journalist at the New Vision. Kazoba Wilson, a clinical psychologist from Uganda. Good to have you here. This conversation is getting more interesting when you listen to what Charlene talked about with the Global Mental Health Peer Network and the Lancet report study, and when you plug in the World Health Organization approach, a lot more is being done. I think as journalists, we just need to find how best we make sense of this data and disperse it. Let's go in West Africa. We're going to hear from a gentleman called Ifen Chukwendi. That name, as complex as it may seem to be to you, that is how strong and passionate this gentleman is when it gets to mental health. He is a development professional and a strategy consultant, currently serving as a senior programs manager at Center for Journalism, Innovation and Development. In this role, he oversees the center's development program, leading to projects in key areas, including natural resources and extractives, climate change, conflict, security, human rights, and health. That is very key. If any, take it away. And for your case, we want to look at what exactly, why the PWLE are important stakeholders in advocacy for ending mental health stigma and sharing experiences of engaging and working with the PWLE, if any. Chukwedi, Chuku, Ife, I think is kindly off for now, but when he returns, we'll be in position. In the interest of time, I'm going to pick on another speaker. Please, not all speakers. If you are to speak, please be close to your machine because time is against us.
Andrew.
Ife,
Apologies for that.
you
I have had an internet.
you're back.
Yeah.
Is it the weather in Nigeria that is failing us here?
No, just a slight internet issue.
All right, cool. Take it away.
Okay, great. So I'll be speaking about the importance of having people with lived experiences, as stakeholders in the advocacy for ending mental health stigma, and how the media can involve them. Charlene had already mentioned that it's apparent that the stigma of living with mental health condition is often worse than the experience itself, and there's no other set of stakeholders who understand, what it means to live with a mental health condition than people who have actually lived through it. So these stakeholders are very important, and it's essential that we involve them in advocacy, because they bring authenticity. They bring authenticity, they bring insight, and they bring empathy to the conversations. Their unique insights, their unique perspectives, their lived experience, enhances the validity and relevance of mental health advocacy. Talking about authenticity, because they've lived through these conditions, they can speak firsthand about the challenges, they can speak firsthand about the discrimination, they can speak firsthand about the stigma that they have faced. The stories of people with lived experiences, because they are authentic, they can resonate with others who may be going through the same experiences. So this authenticity would help break down stereotypes and misconceptions about mental health issues. So when we're driving advocacy, it's important that we have people with lived experiences, carried along. Two, their insight is also essential. The insights from people who've lived through mental health issues or mental health challenges, they are valuable. So those complexities, all of that perspective, can inform a more nuanced and compassionate approach to addressing mental health issues. The third point I want to raise is empathy. People with lived experiences can empathize with others who are going through the same issues because they've lived through it. So that empathy helps to create a supportive and understanding community where individuals feel safe to seek help, and seek support without fear of judgment or discrimination. So we always have to keep that in mind when we're advocating for policy review, when we are advocating for any sort of change at all when it comes to mental health stigma, that people who have lived through these issues, can give us the right perspective. They can help us see the detail. They can help us empathize. They can help us understand what it actually means to live, with a mental health condition. Now, what can the media do? What can the media do to include people with lived experiences in mental health advocacy? One, we can include them by sharing their personal stories. We know that storytelling is such a great tool, it's such a great way to pass across a message. So media organizations can feature personal narratives from individuals who have lived experiences. These stories would highlight the challenges they faced. These stories will show the strategies that they've adopted to cope, and would also highlight the importance of seeking help. We can also include people with lived experiences in various interviews and various panels. Wherever there's a panel, wherever there's an interview to discuss mental health stigma, we have to have people with lived experiences on those interviews. We have to have people with lived experiences on such panel discussions, because these platforms will allow them to share their perspectives. These platforms will allow them to share their insights and their recommendations for ending stigma. Three, with collaborative projects. Media outlets have to collaborate with mental health advocacy organizations to develop content that amplifies the voices of people with lived experiences. So whether it be documentaries, whether they are podcasts, whether they are multimedia campaigns, or whatever project it is that is designed to raise awareness and promote understanding of mental health issues, it's essential to incorporate people with lived experiences in these projects. So we know that the media has the mandate to shape narrative. We have the mandate to inform, to educate. We have the mandate to set agenda. So while we're doing this, we have to carry people with lived experiences along. And what has CGID been doing around this? So the Center for Journalism, Innovation and Development, we are West African Media Innovation Think Tank, and we are driving advocacy, we're driving media coverage, we're driving innovative storytelling, we're driving responsible reporting on these issues. So we are raising awareness to shape the narrative around mental health. We're doing this through our stories, through our documentaries, through various multimedia campaigns. We also have a mental health fellowship, where we train journalists, on how to report and drive advocacy, to reduce mental health stigma. And in our fellowships, in our trainings, in our collaborative projects, we always ensure that we bring in people with lived experiences, both journalists who have actually lived through mental health stigma to, just regular folks out there who have experience, going through mental health challenges. So again, these are my major points, that it's essential to incorporate people with lived experiences because they bring authenticity, they bring insight, and they bring empathy to the conversation. And media organizations can include them by sharing their personal stories, including them in collaborative projects, and essentially giving them a voice, to share their perspectives. And I believe that if we do this, we will keep moving the needle on ending mental health stigma in our world. Thank you very much, and over to you.
Man, I can't thank you enough. You're speaking to the converted. But when you say that lived experiences have a totally different narrative, they shake up someone's belief about it. I've ever been mentally tired, and I told my bosses I can't read news anymore. I'm mentally exhausted. I was very lucky that my bosses understand mental health. Others wouldn't understand it. Lived experiences, you've just brought it how so close it is to our conversations, and as we're setting narratives, why they're very crucial here. And I don't want to lose the ball. I want us to keep the same pace from West Africa. Allow me to fly as fast as I can up into Tunisia. Asma Zribi. This is a distinguished Tunisian junior journalist and a collaborator with the Catch Health Association for this opportunity. Asma has a starting experience in reporting on mental health issues. She played an active role in the designing the curriculum on mental health and suicide reporting, which was developed in cooperation with the Dutch Well Academy in the year of 2023 in March, around there. And she has co-facilitated a workshop on suicide reporting during the Arab Forum on Science, Journalism, and Communication last year. So English ain't her first language, but she'll be assisted by Dr. Malik to respond to questions. But for now, let's welcome Asma. And Asma, your conversation, we want to look at, as a junior journalist and a collaborator with the Catch Health Association, reporting on mental health. What have you seen? Possibly we have mixed as journalists who have been here for quite a long time.
Thank you, Mr. Andrew. Hello, everyone. I'm Asma Zribi, and I'm thrilled to share some insights about my journey as a junior journalist at Carthage Health Association in Tunisia. I find our work as journalists on mental health issues and suicide very sensitive because it shapes public perceptions and attitudes. So journalism transmits ways of thinking and viewing the world, influencing beliefs and opinions. And responsible reporting can reduce mental health stigma by promoting understanding and empathy. However, it can also cause harm if not handled carefully, such as triggering the Werther effect, where sensationalized or detailed accounts of suicide lead to copycat incidents. The question here is, to what extent are journalists in our respective countries skilled in this regard? I personally think that journalists may still be the missing link in the expertise chain needed to promote positive mental health attitudes. And at Carthage Health Association, we try to tackle this issue respecting the learning curve of everyone involved. And last year, I embarked on developing an online pilot Arabic-speaking mental health curriculum for Tunisian and Arab journalists. Our initiative aimed to reduce mental health stigma by promoting accurate and empathetic reports. And this was an interdisciplinary effort involving young mental health experts and journalists in collaboration with the Deutsche Welle Academy. So we faced several challenges, each helping us refine our approach. And first, the novel nature of the topic posed a challenge, and mental health in journalism is not extensively explored in the Arab world. To understand journalists' needs, we conducted a survey. The insights revealed a strong desire for practical, relevant, and culturally sensitive content. Another major challenge was knowledge translation. Health issues in Tunisia are predominantly taught in French within academic circles, and bridging this gap and making the content accessible to an Arabic-speaking journalistic audience was not easy anymore. We used Arabic resources from the WHO and worked on aligning the content with journalists' expectations, ensuring it was both comprehensible and applicable. So, for our first experience delivering an online curriculum, we were honored to have over 50 journalists from Tunisia and the Arab countries participate, and we believe more concentrated initiatives and focused impact measurements are needed to monitor long-term advances. We also introduced our curriculum at the 2023 Arab Forum of Science, Communication, and Journalism. A significant breakthrough for me was co-animating a workshop on suicide reporting with Dr. Melk Ektat, which was a remarkable experience that built my self-confidence in this topic. And recently, I started my first report on mental health, exploring the topic of mental health care resources in Tunisia. Mental health care receives less than 1% of the overall health budget. This project has been a journey of learning and growth, reinforcing my commitment to advancing mental health awareness and responsible reporting in the Arab world. I faced many challenges and many difficulties when working on my journalistic piece about the mental health sector in Tunisia, especially in terms of access to information from mental health care facilities. Disclosing data related to the hospital overcrowding, lack of equipment and beds, and some neglect was really challenging. As officials were reluctant to give statements, especially under the current critical political context. And in conclusion, this training and reporting project with Carthage Health has been for me a valuable learning experience, and I'm looking forward to developing this great work further with international partners and keep learning from each other. Thank you very much for your attention.
Wow, thank you so much. And I don't think Asma you'll need help for English, because your English is, I could hear everything. You're actually good. You're very good. You shouldn't worry about that.
Thank you. It's good to hear that.
And you're doing great. Please, you did great. You did amazingly great. Just hang in there. We shall have a session where people are going to possibly ask a couple of questions, and we shall best to run this. But I want to bring in another speaker here. This is a news director and journalist down from South Africa. She has done it. She has done it. If I can just say that she's a director and journalist, a TEDx speaker, a trainer, editorial consultant, and chair of the South African National Editors Forum for Journalism, Wellness and Safety Committee. Katie, blow it away.
Thank you very much,
Katie, are you there?
Andrew. Yes. Can everybody hear me loud and clear?
Yes, you are.
Lovely. Thank you, Andrew. And good afternoon from South Africa to all of the participants today. As Andrew rightly said, my name's Katie Katapodis, and I am the chair of the South African National Editors Forum's Journalism, Safety and Wellness Committee. This is something which is extremely close to my heart. And in my journalism career and my editorial career over the past 2 decades or so, it's been critical that we have championed this. You know, journalists across South Africa and around the world, and all those who have any kind of contact with media, often talk about the goings on in media as the news cycle. The news cycle is busy. The news cycle is moving at a rapid pace. I like to call it the news cyclone. And this news cyclone, particularly in South Africa, and I know that other countries in the world are no different, but in South Africa, this news cyclone is often so dramatic, and it whips us up from story to story, hour to hour, day to day, week to week. And it's very, very difficult for journalists in our country, in our current media landscape, to often have any time to process the horrific stories that they have been seeing. They're on the front lines of some very, very difficult stories, but the news cyclone means that we go from one breaking story to another, and it's very difficult for them to truly process it. So what we've done as SANEF, in partnership with the South African Depression and Anxiety Group, SADAG, who are also here today, is we've partnered to formulate toolkits for journalists in the country. Over a period of time, it's 2 years now, we've been able to have webinars, in-person, online sessions, where we talk about the roles and responsibilities of media, but also what it is for a journalist to report on these stories and then be expected by their editors to simply move on to another story or to move on and to be well. And we understand that it can have a devastating effect on our personal lives, on our family lives, but also on our professional lives. And in my career as an editor, leading both television and radio newsrooms, I've seen how untreated trauma leads to anxiety and depression, but often it just spills out sideways. And you don't have a sense of exactly what is going on with someone, because a minor issue will become a massive issue. And so we've worked very hard on giving a set of tools to our reporters. But importantly enough, we also want to speak to editors, and we call on editors in South Africa as well to say, you need to understand what your teams are going through. You need to watch them. You need to watch them carefully. You need to talk about these, but you also have to have things available that will assist them, give them space and hold them when they actually are having a moment in their careers. And few newsrooms, far too few newsrooms, regrettably, have got debriefing sessions. Far too few editors have embraced, unfortunately, having psychologists come on board, be it in a weekly session or even a monthly session. So this is the gap that SANEF and SADC has tried to fill. We hope that we are making a dent. We hope that we are making some kind of improvement in the South African media landscape. And we really want to improve and enrich the lives of journalists so that they don't leave the profession and they don't end up going to other so-called greener pastures where they think it's better and less stressful and less traumatic, and end up leaving the industry completely. Because part of our media landscape and the dynamic that we're dealing with now is that senior executives in journalism have left. They've gone to PR, they've gone to agencies, they've gone to become spokespeople, they're doing government work, and it's left a dearth of talent, expertise, and professionalism in our industry. Which brings me very quickly to what our role is. We have to report ethically and responsibly. And I love what I've been hearing so far today about the role and responsibility of journalists, particularly when it comes to issues of suicide. There's got to be constant training, constant discussion, constant education. We cannot leave it, unfortunately, to the individual newsrooms or the editors. We've got to come in, at least as SANEF and SADC, and really help instill some of this responsible and ethical journalism. I think, Andrew, I'll leave it there for now, and we'll take the questions later.
Amazing, amazing, amazing. Thank you so much. That was heavy. And if you are any editor and you're here and you're leaving the newsroom, the gap you leave, I think Kate has hinted about it, that you need to be very cognizant of the gap, and you train a couple of more people, especially about mental health. Now, those who are having questions, you're going to raise your hand and you drop your question either in the chat, or you can just unmute your mic and you ask your question. Be specific to whom you're sending that question to. And please, I request that you introduce yourself in the chat. Anyone who is part of this. Kilonzo, I've seen you here in the chat, very reputable. Katie as a journalist, that is something really great. So it's time for questions. And we have less than 20 minutes. It's 19 minutes before closure. So you raise up your hand, and then you'll unmute your mic and you let us know who are you sending the question to. Be very brief. Please don't tell us stories back and forth. We can have that through links, but let your question be straightforward. Okay. Those of you who don't want to speak, you can just send your question in the chat. I'll be reading a couple of them here. But again, special thanks to our great partners that made this happen. It wouldn't be very possible if we didn't have partners like you that helped us to mobilize. Carter Center, who shared it with the partners, Mental Health Network of Liberia, who joined in from the Carter Center in Liberia, SADC from South Africa. It's such amazing to have you here. Comrades from Kenya, and all the journalists for the Innovation Center for Journalists Innovation and Development, and the Carge Health Association. It's such an honor every other time to see that we can come together and mobilize for the right thing. Matthew Muti, What's your question, and to whom is your question going to? Matthew Motiso.
Yeah, thanks so much,
Mhm.
Andrew. My question is going to Ben Adams.
Okay.
It's regard some infographics that he has shared on the chat,
Mhm.
and also the report that he shared. Just in case an organization like ours would want to pick up and curate either our own infographics from the message, but also keep the key messages or the report as it is, but some pieces and pieces of it. How do we go about it? There are some specific guidelines or some rights, anything to do with that? Thanks.
Okay, Adam, you mind responding to that?
Yeah, no problem. Thank you, Matthew. And it would be great to hear of organizations adapting and using the guidelines, in the way that suits them best. We do have some guidelines on adaptation and also on copyright, especially if it's something that you want to continue with WH logos, etc. If you share your email with me, I can actually give you the links and the emails that people that you will need to contact. But we do have guidelines and
Nilikuwa nataka kutoka nikaambiwa wametuma mtu huko, so nienda kufanya nini?
Hasna, kindly mute. Carry on, Adam.
Sorry, yeah, no, I'm finished. If you share your contact details with me, I can share the link and email addresses. I can even have a quick look for it now.
Okay. Yeah. Thank you, Adam. Any other person with a question? Kindly just raise your hand, and I'll be in position to see you and let us know who your question is directed to. Mental health advocates. Don't be shy. Don't be shy. This is our space.
Can we come in from Liberia?
Please come through.
Okay, Bill Jala from the Court Division will come in. Bill, please go ahead.
All right, I just like to make a comment on one of the speakers that talked about responsible journalism. It is quite easy, when people report about suicide and other crises in mental health, the way the report is carried out, does not bring out the magnitude of the crisis. Rather, is either trying to make fun of it or romanticize it. So as I listen, as a person who has had mental health issue, I started shaking my head that what our brother was speaking to was very correct. And so in Liberia, we had the Reporters Network that went through a series of training to know how to report on mental health, what are the right languages to use. Yes, language that will not demean a person who has gone through issues.
That will even not stigmatize people who have mental illness. Yeah.
So that's just a comment I really wanted to make as I was listening to the various speakers, and our dear sister from South Africa.
Okay. Kate.
Yes. Thank you very much. I didn't hear much of the question. It broke up on my side.
The question was about the stigmatization, the language and the tone, and possibly they're wondering how have you been possibly able in South Africa to achieve all these? And there are a series of trainings they've gone through back and forth, but to achieve it, especially the tone and the language, because oftentimes when they're reporting, we end up stigmatizing the victims instead of amplifying their conversation.
So I must say, I'm quite proud of the work that South African journalists have done around suicide in the past few months. We recently held a workshop on reporting on suicide and what that looks like, and with particular reference to the language that we use. Not having sensational language, not romanticizing it, I think is what I heard part of the question being. The whole issue about the word to commit suicide was also debated. And for a long time now, for a while, I've seen South African media shift from commit suicide to died by suicide. And that for me is an important step. It's a really significant step, because I think if we can continue to do that, we are not criminalizing the act essentially, and we're also reporting on it in a sensitive manner. We had a horrific story here last week. 4 teenagers in a local school all died by suicide over a period of 3 or 4 days. 3 of the young women were pregnant, and one of the men who took his life and died by suicide was believed to be the father of one of the children. And that was a very, very difficult story to report on, but it was done with great contextualization, with great framing, with important language, and importantly, it was also backed up with healthcare numbers and telephone lines. If you're in need, go to this website, call this number. And for me, that contextualization is very, very important, because it doesn't sensationalize or romanticize it in any way, but it's also very sensitive for the family that's left behind, for the friends that are left behind. So in that instance, and I noticed that Ben in his infographic said you shouldn't report on how the suicide happened. In this particular story, they did say that these teenagers ingested poison, but I thought even that was quite well handled, because they didn't go into the gruesome detail of what they did to them. I hope that answers your question in some way.
That does. And there is a question for Sunke. How can we report about stigmatizing the families? Sunke, are you there?
Yes. How can we report on? Sorry, you broke
On
up a bit.
stigmatizing, on how can we report without stigmatizing the families?
Yeah, unfortunately, stigma by association is also a thing, and I don't think people often understand the impact it has on families, or even those who work with people with mental health conditions. But I think in the same manner as you would report a story of someone with lived experience, you should also deal with that matter the same as with family members, to also consider them exactly the same, or saying that they experience almost the same type of stigmatization and the same impact of that stigma.
Thank you so much. Saziso, Lami? Unmute your mic.
Yes. Yeah, no, I would like to commend the good partnership between SANEF and SADC. I hope they have a plan to expand, because most of the journalists aim to reach more provinces in the country, in South Africa, as she mentioned, that there is a lot that we are facing as a journalist. And I also appeal that they do more capacity building for mental health journalists, because I think for South Africans, it's still a new thing to report on mental health, but I see the value of it.
Katy, do you mind responding to that, please?
Thank you very much. Thank you for that. I'm so happy that you see the value in it. Extending it is critical for us. And the more that we can do, the more people we can reach, the more we know that our work will be impactful. So, Saziso, definitely. I think it's a good idea if we all share our email addresses as well. And I will certainly add you to a database that we have both at SANEF and hopefully at SADC as well. And hopefully that'll be of assistance.
Amazing. There was another question for you, Kate. Someone is asking, please, if you need any more details and materials of mental health and especially what people are doing, share your email in the chat, that you'll be in position to be helped. David says, how can a journalist differentiate between mental illness and mental disorder in their reporting? My question goes to Kate.
So I'm certainly not a psychologist or a psychiatrist. I would hate to answer that question in terms of how they would actually do it. But what I would say as an editor is seek help, have a conversation with your editor, have a conversation with a mental health care professional who can maybe just help you decide or differentiate between these two. That for me would be the most important piece of advice. Get help if you need it. And of course, you know, there are some symptoms that one feels that are widely available. If you just have a look at them on the net, and if you're experiencing any of that, then I think it would be a really good idea to speak to a doctor or a mental health professional. You can also reach out to SADC.
That's amazing. Friends, we just have a couple of minutes to wrap this up, and I really want to thank you so much for the time you've been with us. But before we wrap this up, allow me to invite Shellen to share the recommendations from the Lancet survey. And after her, we shall have Karen to share the Carter Fellowship. And those interested, pay more attention to these. Shellen?
Thank you very much. Yes, unfortunately, I couldn't squeeze it in the beginning, but just to briefly go over the 8 recommendations. Recommendation 1 and 2 speak specifically around policy reform, and also about the evidence-based practical toolkit that needs to be adapted and implemented at country level. So progress in terms of that has been co-production of the toolkit that I just mentioned, and WHO European region led that piece of work in partnership with Global Mental Health Peer Network and King's College London. Recommendation 3 speaks about legislation that perpetuates stigma and discrimination and human rights violations. And yet it also specifically speaks about decriminalization of suicide. And we know some progress in some countries have been made where suicide has been decriminalized. I know Global Mental Health Action Network specifically hosts suicide working groups, host a suicide working group. And I think the media has also been very important in that, by reporting and giving coverage to the successful decriminalization efforts. And I think that helps also to gain support in terms of that. Recommendation 4 speaks about mental health in the workplace, and WHO has a guidelines for mental health at work. I think that was published in 2022. And what's very encouraging is that the Mental Health Atlas also now include monitoring of country implementation of work-related prevention and promotion programs for mental health. Recommendation 5, briefly speak about kind of training of health professionals, pre-qualifying courses to be precise, to also educate professionals in terms of how to deal with stigma and applying anti-stigma initiatives through their work. Recommendation 6 is specifically for the media, and this session is exactly one of the progress made and implementation aspect of that that United is hosting, and also with the media manifesto of United and the suicide guidelines. 7 and 8, I'm almost done, promise. That one speaks a lot about supporting people with lived experience. A recent paper that was published is taking that Lancet Commission lived experience survey that was conducted and kind of digging a bit deeper into the results of that. So that paper is available online. It's called Exploring Perspectives of Stigma and Discrimination among People with Lived Experience of a Mental Health Condition, a co-produced qualitative study. Global Mental Health Peer Network has also partnered with Stellenbosch University, so we will be running an annual survey to assess progress in terms of more broad mental health progress, but also related to stigma. And just finally, I just want to say that for me, it's so important that the media, although there's one recommendation focusing on the media can play a very important role across all of the 8 recommendations by really reporting on the progress made, really highlighting where progress is still needed to be made, and really involving people lived experience throughout these recommendations to bring those stories, the real stories, across. Thank you so much for the opportunity to elaborate on this.
Thank you so much, Shalene. Shalene, maybe you could share that with us in the chats, or a link to that can actually be accessed by other colleagues here. Karen from the Carter Center, good to have you here.
Hi, Andrew. Thank you so much. Really quickly, we have a new fellowship launching. I know that a lot of you are aware that the Carter Center has had journalism mental health fellowships. Actually, the Rosalind Carter's name, the only program within the mental health program that bears the First Lady's name. And so that program's been around over 28 years. We have over 300 fellows who form a very nice cohort and help each other with these topics, with working through their reporting and continuing to advance and mature the reporting. So one of our frustrations is that we'd love to offer fellowships in every country, and I think we've kind of found a way to start doing that. So we have a new fellowship that we'll be launching on our website. I'm going to share it in the chat. Over the next week, we'll open applications. The funding that's come through has specified that this be a climate change and mental health related topic. So any topic relating to climate change and how it impacts mental health, specifically in Africa or South America, those are the stipulations of the grant money that we've been provided. So hopefully this is something we can have every year. There will only be one this year, and the fellowship application will open in the next week and will run through the middle of June.
Okay, friends, before you leave, make sure that you follow the Carter Center so that you get this notification. I have a request that we all turn on our video cameras so that we can take a group photo.
Can I come in quickly from Liberia, please?
Please, in a minute.
I mean, mental health services in Liberia has been left to NGOs. As person needed the services, how can we advocate with governments in Africa to prioritize mental health services?
Any media?
Did you get a question, or should I come back?
Okay, maybe I can best respond to this in one simple word: partnerships and collaborations. It is very wrong for us when we work in silos or when we work just in our countries, but joining platforms like the United for Global Mental Health and sharing what actually you're going through on your end will be in position to help you out a lot. I'll tell you, this network has a lot of resources. Be on that platform and put whatever you're doing, people will come through. My first event that actually got a lot more support from the group, most people came from Nigeria. I barely even knew them. They said, we have tried this, we have done it, please, you could do it this way. So my brothers and sisters in Liberia, the best thing to do, engage as much as you can on the Global Mental Health Network platform, engage, throw in what you're doing, and we're going to be in position to come through. And please share your emails in the chat before we have this shut down today. It's already 5 p.m. Let's put on our cameras and we take the beautiful photo of the group. It's been such an amazing conversation. Believe you me, the next date of this mental health, African Mental Health Media Roundtable will be coming very soon. As and when it shows up, please show up or tell a friend about it. And after we have had this conversation, find a way, if you can, write a blog about it, write a vlog about it. Let's make partnerships from this. And above all, let's impact lives. So let's have the cameras on. Let's have the cameras on. Caroline Machonge, David Yates, Esther Kirango, Joe Harrison. Okay.
Could you take a photo and with all of us currently, Andrew still in the middle?
Okay. Let me try to take the photo. All of us, let's smile, look in the camera and smile, look in the camera and smile, and ta-da! Thank you, everyone. It's been such an honor to be your chairman today. In the next agenda, I hope it will be Liberia or someone from down South Africa or someone in Malawi or Kenya. We believe rotational chairmanship is the best way we can be in position to make sure that we tap into as much brains as we can. My name is Andrew Chamagiro, and I want to challenge every one of us after here. Please follow the Carter Center and make sure you get the links and the notifications as and when that opening is open, and tell more friends about these forums that we can be in position to give more resources to our people. Good evening.